welcome back to my channel. I'm gonna do an update on my bariatric surgery. Today marks 2 weeks of me doing the bariatric surgery. I am doing okay. I have no issues. I never had any complications, as I said in my previous video. I am digesting and holding food improperly. I haven't had any other incident. Only maybe I had an incident. I had in the beginning. I had the incident with the Gatorade. I drank it and I threw it back up right away. And then I tried. What did I try the other day? About today was Tuesday. I tried on Saturday or Sunday. One of those days I tried. My daughter was eating Pringles, and I just took. I grabbed like a stretch of it, and a piece of it broke off, and I ate that piece, about half of it, and then it was fine for a minute, for a bit, and then afterwards, I threw it up. So yeah, so I'm very cautious of what I eat. I more eat broth and protein shake, Jello, yogurt. I have a lot of water. As I said, I'm trying to get my 64 ounce in. I'm trying not to be dehydrated. I drink water so that I can see that my pee is see through, white, as light yellow as possible. So yeah, so no complications. My incisions are healing quite fine. No, nothing out of the ordinary. My skin is going back. Maybe last week it was a little bit tender. So what I do in the nights, I use my silicone. Is it silicone? I think it's a silicone wash. I just take a piece of cotton pad and I wet it, and after I shower I kind of clean the area, and then I put some polysporin and vitamin E oil. So the vitamin E oil, I just take one of the vitamin E capsule, and just poke a hole and just use the oil from the tablets and put it on my skin. So that's all I do, and then I try to keep it as all the wounds as dry as possible. Especially the one I have one right underneath my boobs, one of my boobs, and because my boobs is on it, it's not getting as much hair. So what I do in the nights, in the days I wear bra, but in the nights when I'm going to my bed, after I put the ointment, I put a little bit on a kind of cotton pad, and I put it over it, and then my breast rests on it, and it keeps it dry through the night. I've seen it since I started doing that. My wound hasn't been, it's getting dry and healing properly. So yeah, so that's it for the wound. I'm taking all my vitamins as prescribed. As I said, I'm drinking my water. So my daily the way I do is I wake up in the morning, I drink some coffee, like 4 to 6 ounces of coffee, depending on how my body feels. Because I have to drink water at first, because I've programmed myself so much to drink water in the mornings. The first thing I put in my mouth, thanks to my boyfriend. So every morning I wake up, I drink. I always have a bottle of water beside my bed. So what I do, I drink a little bit of water until I feel, by the time I brush my teeth, wash my face, spread up my bed, put on my clothes, and go out into the living room, boil the water in the kitchen, and all of that. It's the water might flow through my body. So I started to drink. So I drink coffee. Yeah. So sorry, I had to cough. So I paused the video. So after the water and all of that, after I do all my morning routine, and then go into the kitchen to boil the water to make my coffee, all that water might pass through my body already. So then I move on to drinking my coffee, and my coffee, as I said, is 46 ounce. Sometimes even less than 4 ounce. It just depends. I make 6 ounce, and then I drink as much as I possibly can. My stomach can hold, and then put the rest in the microwave. And if I feel like some more coffee throughout the day, I go back and drink that. So that's what I do in the mornings, and then that was about 7:30, 7:30, 8 o'clock, and then by like 11, 10:30, 11, I'll drink a protein shake. But between 7 and 11, I'm drinking water. So I guess that also helps to keep my stomach full. So about 11 o'clock, I drink a protein shake, because I'm trying to get in as much protein as possible, which I'm not doing the best stuff. But I drink a protein shake, and then about 11, 12, 1 to 3 ish, I drink some broth, and then um, in the middle, like going down after that, now I'll eat a yogurt. I'll eat, if I feel for a little bit more broth, I'll drink more broth. But sometimes I don't feel like anything else after that. After the broth, and the broth is about 4 ounce, 4 to 6 ounce too. So I don't feel after that. After 3, 4, 5, and then I drink water. And then if I feel for some tea, I'll make a tea bag, because I programmed myself to drink tea the night before all of this. So sometimes I do feel for some tea, and I go make a tea bag. And yeah, so that's what I've been eating so far. As I said, I've tested stuff, but they do not agree with my stomach, so I try to stay as far away as possible. So usually, I do like a weigh-in on Tuesday. I said once I did my surgery, I said I promised myself that every Tuesday from the day of surgery, I'm gonna be taking pictures and taking my weight. So today was the first day back for me at work, and I remembered I woke up and I got dressed because usually as I wake up and I brush my teeth, I wash my face, pee, do whatever else, in the bathroom, not shower, pee and void before I weigh myself, and then after that you go shower and get ready for work. But I forgot. I don't know how I forgot this morning. I think I forgot that it was Tuesday or it was. I don't know, but I didn't take my weight. I didn't do my weight. So by the time this video is um up, by the time I put up this video, I'm sure to wait. So I put the weight on the screen somewhere. But I did manage to take a picture because I remembered some point throughout the day, and I said, let me take a picture in a mirror. So what my goal for that is, especially for the pictures, is like after a month of each picture, I'll take another picture of myself in the same outfit that I took that picture in. For example, this morning I went to work, I was in a jeans and a sweater. I said I'm gonna, a month from today on the same day, March the 21st, I'm gonna take another picture in the same outfit and compare them to see how far in the journey I've gone. Um, yeah, so today was the first day back to work. It wasn't bad. Nobody really knows that. Nobody knows at work. Only my family really knows what I did. I don't think I have to tell the people at work what I did. Eventually, they're gonna find out when they see me losing weight because for the past 20 odd years that I've worked there, I've always been chubby. I haven't got this big. I got this big after I had my second daughter. But when I started working there over 20 something years ago, I've never been skinny. So if they saw me, when they start seeing me like losing weight or a lot of weight, I'm sure they'll wonder why. And I can't go around telling them, oh, I was exercising, I drinking my water. I can't do that. After, eventually they're gonna know. But as of right now, nobody knows that, for only my family, as I said. So today for lunch, for just I wouldn't even say lunch, but today to eat at work, I brought protein shake. I did a coffee this morning. Again, 4 to 6 ounces of coffee this morning in my travel mug. I didn't even finish it. I drank as much as I could on the 20 minutes ride to work, and then I took the cup out of the car, but I didn't end up drinking the rest of it for the day. So I did coffee in the morning, the same routine. I drank the protein shake a certain time of the day. I brought protein shake. I brought broth, but the only thing I brought different was last night what I did was I decided that I'm gonna start because at this point, 2 weeks in, I'm supposed to be at this puree stage. But I don't think I'm gonna do puree. I think I'm just gonna go soft food because I think I'm tolerating everything. So whatever I can't tolerate, it will come back up. But whatever. So what I did last night, I did I had a small potato. I know I'm not supposed to be eating potato, but that's the only thing I didn't want it to spoil in the fridge. So I peeled it and I boiled it. Tiny potato, like a small thing. That's gonna last me for the whole week, or maybe if I don't throw it out before Friday, it will last me until about Saturday. So I boiled a potato and some green peas and some, like I had a can of peas and carrots. I opened the carrot and peas. I took some out of it, and then I put it with the potato. And then after the potato finished cooking, I crushed the potato and the peas together. Look like baby food, right? So I crushed those together with some butter and some sour cream. Yeah, some butter and sour cream, and it was very, it was coming like mashed potato without the mayo. So butter and sour cream. I crushed the potato with it. Also, I had a can of tuna. One of the things, not tuna, can of sardine. One of the things I realized with sardine is that a can of sardine has 17 grams of protein. So anywhere I can get my protein from, I'll try to get it. So what I did with the sardine, I saute onion, peppers, sweet pepper and hot pepper together, and then I added the sardine, and I cooked it up, and then I crushed it just like a potato. Crush it out in the pot, and everything crush up because everything is cooked, and then it gives it that consistency of baby food again, soft food. So what I for work, I brought a 2 ounce container of each, 2 ounces of potato and 2 ounces of sardine, and I also brought about 4 ounces of broth. So I brought about 6 ounces of broth. Yeah, about 6 ounces because the dish was a good size. And also with my broth, I also seasoned it. Like it's just a can of, here in Canada they have Tim Hortons. So Tim Hortons has this chicken soup, as I said in my previous video, that I doctor up. So it's a can of Tim Hortons soup. It has I think it has not noodles. It has some kind of shell pasta, carrot, and I think some other little season. And I threw it in the pot. I added thyme. I added scallion. I added some garlic. It's like more garlic seasoning. I added a pepper, Jamaican and Scotch bonnet pepper to make it hot. A piece of pepper, and cook it. So you cook it down so let it boil up so all the season can come together. And surprisingly, it was so good. Tim Hortons should have had these seasoning to their soup. So good, so good. And then I strained it and I took out the pasta, but they had small pieces of carrots and they were very soft, so I added it to the soup. And then so I brought 6 ounces of that to work also. So I brought a protein shake, coffee, 2 ounces of potato and 2 ounces of sardine, and about 6 ounces of broth. And I brought also what is called a jello. I brought a jello and I brought some I juiced some beets and some celery and all of that in a bottle. I don't know where I was going with so much. I don't know why I thought I was going to eat so much, but I think I brought it just for the fact if somebody see me eating something small, they'll say, "Oh, you're not eating." I say, "Oh no, man, I have my food in my lunch bag." I think that's the reason why I brought it because the only thing I ate, I drank the coffee, I drank the protein shake, I drank the broth, and I had a little bit of the um the sardine because I didn't want the sardine to go to waste. As I said, it has 17 grams of protein. So anywhere it's even if it's even 1 gram I get from it, I got something out of it. But I didn't eat potato, I didn't eat the jello, and I didn't do the beetroot or anything. And that's it. So the coffee, protein shake, broth, and a little bit of the a little bit of the sardine and water. That's what helped me out through the day. And I was pretty full, you know. Right now, I am my stomach is getting to a point where it can tell me when I'm full. As I said, in the beginning when I started doing when I did this first, I would burp. I would burp small burp first, second burp a big, and when I'm really full, it just burp big before I reach to that stage of throwing up. But now the burping has gone. Now my stomach growls when I'm full, and I think yeah, I'm noticing that's what happened when I'm full. When my stomach reaches the limit, it starts growling. Yeah, so I know when to stop. So I haven't had. I came in early and I made some tea because I felt like I wanted some tea. I drank some of it. I didn't. I drank about 2 ounces, maybe 3 ounces of it. I didn't feel like anything else for that. I took out the yogurt and I said I was gonna eat, but I put it back in the fridge. I'm gonna eat something before I go to my bed. I'm not gonna go to my bed without getting something in my stomach. And then I'm drinking water. I have my this is my water. So I'm drinking my water. I think I have this 27 ounce left to drink because at work, I drank water a lot, and then I'm gonna try to finish as much as possible before I go to bed. And then I'll maybe eat the yogurt. Maybe I'll get a little bit of the sardine in because the sardine I cook it spicy. It's spicy. The sardine is spicy. The soup is spicy. The broth is spicy. So it's edible. Yeah. So I try to make anything I'm trying to do. I try to make it as I like pepper, so I try to make it not overly hot, but as tasty as possible. So yeah, that's it for the update. Really, first day back to work after bariatric surgery. I have no complication. Thank God for that. I thank Jesus. I thank Him every day that I haven't had any complications, and I'm hoping never not to have any. I take my vitamins all the time on time. I make sure I take them every day. I don't miss. Um, I am trying to do as much as possible to the beetroot and so as I was saying, I thought God. Sorry, I'm trying to hide my double chin, but it's there. It's there. I can't hide it. But it's not even double chin. It's just the way I sit. But anyways, um, so as I said, I have no complications, and I thank God for that every day. I'm a stomach sleeper, so I realize that in the mornings when I wake up, I'm waking up on my stomach, so it doesn't hurt. As I said, the incisions are okay. Nothing really, no complication. Um, I feel it. I feel the weight loss in my clothes because I wear this jeans today from American Eagle, and it was a little before it pulled up and everything, but in the stomach part, in the waist part, it would be tight. Excuse me. It was a little snug before. Today when I put it on, it went straight up without me having to jump up for it to go. I never used to have to jump up, but I used to have to jump maybe 1 or 2 times to get in it. But this time I didn't have to jump; it just pulled straight up over my butt. The only thing is that even before this, my butt used to be, it used to be on my butt, but my butt is not that big. But it went over my butt today, and I buttoned it. I had no problems. I sat down in the chair before. Before at work, I would have to sit and adjust it or adjust the way I sit or sit down and then pull the waist. Or no, today I was fine. I just sat down and nothing. I didn't even realize I was just sitting down and nothing. Yeah, and then the sweater I wore today. This is like my second time because I had it in the closet and I didn't wear it because I said it's too big for my stomach is too big for it, but it wasn't. But I wore the shirt the second time, and you could see in this part of the shirt, the neck part. I washed it and I laid it flat to dry. I don't hang it or I don't dry it in the dryer. I washed it and um, so it didn't stretch or anything. It just I don't even know how to describe what right up in this section, my chest section. I realized was a little big and I had to keep adjusting it before I had to adjust the stomach part. But I realized up in the chest part of my shirt is getting big. Even my bra, I wear bra every day, but even those I realized, cause bigger boobs, I have the bra with the three section, one, two, three. Usually, you start out with the first hook. Today, this morning, and yesterday and the day before, I realized that I had to put it in the last three hook at the bottom. Yeah, and even when my boobs is section, there and in my boobs it's getting bigger. There's gaps between my boobs and the bra. So I guess even if I don't lose any weight, 'cause, there's a time when 2 to 3 weeks where I don't really lose a lot of weight. But even if I don't lose weight, I notice it in my clothes. Yeah, in my clothes. So that's a good thing. Yeah, even this shirt that I have on, it always was a little snug, big, but now I'm realizing it's really big. It's getting bigger, but my double chin is not going anywhere. I took a face picture this morning of myself. Sorry, I came in a shower. I washed my face. I look tired because I'm tired. So what was I saying? Sorry. This morning I took a picture of myself. I'm gonna put a picture. I think I'm gonna put a picture in here somewhere if I remember, if I know how to do it. All right. So I'm gonna put a picture of myself before and after face. It's a small difference. It's not no big difference. I think the funny thing is it's in the same shirt that I had on this morning. The first time I wore the shirt was like maybe about 2 months ago, about December. Yeah, the beginning of December, and then I took a picture then, and then this morning I wore the same shirt. Didn't even realize it until I was going through my phone, my pictures on my phone, and then I'm like, oh, I have a picture with the same shirt, and then I put the picture both of them together. You could see the difference in my face. Yeah, you could see the difference in my cheeks and down here. So in that picture, my head is straight, and you see this straight like this. You don't see my neck. When I put it down like this, anyways, that's not flattering. But before, let me stop rambling. Anyways, that's it for the update. Everything is going great. I'm gonna continue doing what I'm doing. I'm gonna try not to add too much carbs in my process. Yeah, I'm gonna add more vegetable because I realize that the peas and the carrot is good. I'm gonna put more carrots and peas, and even if I'm gonna do potato, I'm gonna try to do sweet potato. I'm gonna find more fiberized food to eat. I do use a bathroom. I do void. Um, I don't have no problem with that. The other day when I ate the Pringles, and I think I had an issue like afterwards, because even though I threw that up, I still had, like, the next morning my stomach was giving me it beat me, man. My stomach beat me left, right, and center. I couldn't move. I just had to lie on my bed, and from the bed to the bathroom, that's what I was doing. So I'm trying not to get that way. I test myself though. I'm not supposed. I don't know. I'm testing myself. But yeah, so that's it. So the puree stage is supposed to last for a week. I guess I'll do, since I'm not doing puree, I'm doing soft food. I'll do puree for 2 weeks, soft food for 2 weeks, and then after that, I guess I go back to the regular eating, not regular eating, but regular food. Yeah, I go back to regular eating because the stomach is not letting me eat. But I'm not understanding that. It let me drink water, 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 but it's not. I can't really eat a lot of food or drink a lot of broth. But I did this for my own sanity. I did this as a helping tool for me to lose weight. Because over the years, I'm not 20 or I'm not 30. Over the years, I've always tried to lose weight. I've done everything you can possibly think of: genetic weight loss, fasting, keto. I did it all, and some of them work. Keto work. I lost 19 pounds with keto, but after that, it was like, you know, I couldn't do without rice. But I'm still gonna eat rice, but instead of eating the whole cup of spoon of rice. I'm not talking about the small spoon. I'm not talking about the tablespoon. When you're cooking spoon, a couple of that, like 4 or 5 of that with some 2 or 3 pieces of chicken. I could never go back and eat that. Can you imagine? I would throw up from now till next week. So instead of eating a whole, maybe not even 1 spoon of rice, I can manage to eat bites. You know what I'm saying? So it's a tool to help me lose weight, because at the end of the day, I don't want to die like, fat. I don't want to die because I'm fat. You know. So yeah, so anyways, let me stop rambling. It's 21 minutes already. So that's it for my update. I'm doing great. 2 weeks update. Now February 22nd, I'm doing great. I have no issues, and I thank God for that. I heard people who did the surgery and had issues. Some people have, some people didn't. I am thanking God that I didn't have any issues. I'm not going to see the doctor until about March 1st, a month after surgery. I've never been skinny. I've never been skinny. I've never been a skinny girl. I've always have body. I've always had shape. Always had the hips and bottom and small waist, and it's just kids just mess up your body. I've never been skinny. I don't think I was born to be skinny. I was born to be voluptuous or thick. So I'm not looking for skinny. I'm looking for to be able to go into the store and buy anything I want. To be able to look down on my feet and not see my feet swollen. To be able to wear, to be able to be in a, I don't even know what size I wear normally in a shoe, but I have to buy a level because my foot swells. As I, before I even put my foot on the ground, once I wake up in the morning, my foot is swollen. My foot is swollen 24/7. I can't, when you look at my foot, when I say, oh, my foot is not, when you're in the bed and you're looking at your foot and you're like, oh, yeah, just wake up your foot and somebody come and say, oh, your foot is swollen. That you're rejoicing that it's not as swollen as that. So all of those things, all of those non-scale victories I'm looking forward to. My foot not swelling, my knee not hurting. Me can get up off the bed or off the couch um, without having to have any pain. Me having to walk, I can take flights of stairs. I go up 2 flights and I'm out of breath. Me wanting to go for a walk or a jog, just to get some exercise, and I don't want yourself to be in a good position to wipe your butt properly. All of that, I want to be able to do. I want to be able to do those things with ease. You know, yeah. So I don't care what nobody wants to say. I don't want. I'm not ashamed of what I did. If you don't agree with it, you don't agree with it. I am a grown woman with kids of my own, and I decided to do this for myself. Who don't like it, who want to come into my comments and comment something about it's the easy way out. The same person who is behind that saying that is that person needs to lose weight too. So don't come at me and talk about this is the easy way out. I will send you up underneath your mother. Okay? Not the person. I am nice and sweet in person and also not in person, but don't test me. I will tell you about your mother body parts, and I'm gonna leave this in the video. As I said, it's about me. 2023. It's about me. I am not looking at what other people have to say. If you don't agree with it, don't agree with it. Just like if you do something and I don't agree with, what am I to tell you that? Oh, you did it wrong. I have no right. So anybody who wants to say this is an easy way out, go and your mother. But yeah, so I think that I say all of that to say this. I think one of the reasons why you're not seeing a lot of um, videos or anything people not posting is because a lot of them are ashamed, or a lot of them are afraid of what other people, not ashamed, but they're more afraid of what other people are gonna say. You can't live your life for people because at the end of the day, when you drop down dead, nobody, those same people who's behind it is and who is talking about, oh, it's the easy way out and you're gonna exercise and diet. Those same people are gonna be what, living their life. So guess what? I am doing this for me, and I don't care. So I want to make it not popular because I don't think anybody can just go and get it. You have to have a certain BMI, you have to have all of that, in order to get approved. I realized that a lot of people in like videos that I watched is like people who like any size, like any weight, they just don't feel comfortable with themselves and they want to lose weight and they tried everything and it didn't work. And this is just a tool. Your stomach is not as big as it used to be. This is just a tool. Because believe me, I could have boxed off like 4 or 5 pieces of chicken, okay? And a big, I tell you, a cooking spoon. I'm not talking about tablespoon. I'm talking about cooking spoon. 4 cooking spoon and a patty. I'm Jamaican, so beef patty and cocoa bread. I can box off 4 patty in one sitting with 2 cocoa bread and plus 2 drinks. Because I drink 1 drink with 2 patty and what? Please. Popeyes, I can eat a 4 piece chicken meal. I can't go back and do that now. I could if I want my stomach to stretch and if I want to throw up. But maybe not even one of the pieces of Popeyes big old piece of chicken that I can't eat. But I did it for me. Because, to control my eating. One of the things I want to do is get back into the gym. Because I used to exercise and I did lose weight, as I said. But I want to get back into the gym. They have a gym at work. Although it's 2 days a week, you can go anytime you want to. I'm just going to do 2 days a week and do more weights and the Stairmaster. And then when I'm home, one of the things that helped me lose weight the last time was I used to exercise every morning. Every morning I used to wake up at 5 o'clock and start exercising for 30 minutes, 30 to 45 minutes. And all the videos on YouTube, and you could have seen it in the difference in my body and in my face, as I used to get up every morning and do that for myself. So when I'm not going to the gym at work, I think I'm going to get up and do that in the mornings. Just exercise for half an hour to 45 minutes. Put YouTube videos, and then I hit the gym hard when I go for that hour at work to do my do weights. So yeah. So anyways, that's it for the video. Sorry, let me turn the camera. That's it for the video. I am done. So this is 2 weeks. I have no issues, as I said. My eyes are tired. Somebody please tell me what is this called? These, well, it's not my eyes, but the black. I guess the black around the eyes. What causes it? Is it too much sugar? Is it too much something? I don't remember what I saw somewhere where they somebody said something, but I can't remember what it was. I'm trying to like look at dark circular. I don't like it. I don't like it. Then I don't like it. I want to get rid of it if it can get rid of. But yeah. So that's it. Um, I've spoken for 31 minutes, almost 32 minutes. If you have any questions, if you're here in Canada, yeah, have any questions to ask, please feel free. Canada or wherever you are, please feel free to ask questions. I'll answer them as best as I can. If I don't know the answer, I will ask somebody else, or if I know the answer and get back to you. I'm gonna do more videos. I don't know. I did say I was gonna do any YouTube video on it, on this whole thing, but I think I'm gonna continue doing it. I have a few videos. I think I'm gonna start posting all the videos at 1 month. When I'm 1 month post stuff, I'm gonna start posting the video because I do other YouTube videos for other stuff that I do, and to I want to show the before and after. You know, I don't just want to put it up like that, but I'll make sure to put my weight in it. I'll make sure to show the picture of my face, the face-to-face picture that I took, pictures of myself from December to now. The weight that I was at December and the weight of surgery is almost the same. It's nothing, not really that much of a difference. So my face would be the same. So I'll do that. I'm gonna do. I promised myself. I promised in the previous video that I'll be doing like the type of pills that I take for my bear for after the surgery. As I said, it's the same pills that I usually take before. The only thing that's missing from it is magnesium, and I cannot wait to go back to taking my magnesium because I feel like vitamin D is absorbing the body better with the magnesium pill, but that's neither here or there. So I'm going to do a video on magnesium, not magnesium, the pills that I take per day as prescribed by my doctor. And I'm going to do a video, maybe I do like a day of eating as a bariatric patient. It's not nothing big, guys. Maybe I do it after 1 month. Maybe I do a small video, like a quick short and show like all the things that I eat for the day. Um, Maybe I don't know it, but after a month, I'm going to show you what I've started incorporating back into my diet, based on how I used to eat before. Because as I said, I'm more eat Jamaican food, not rice and chicken. I'm more eat Jamaican food, so I'm going to try to incorporate a lot of those stuff back into my diet. What else? So yeah, so that's it for this video. Sorry if I wasn't looking into the video. It was my trying to avoid looking because my eyes are tired and my I look back and forth, but I'm sure it's good. Um, I hope you like the video. Share the video, subscribe to my channel for more content. Not just bariatric videos, I do other contents on my channel. I do like cooking. I have a lot of videos on my channel cooking more Jamaican food. I have videos on my channel with doing bracelets because that's one of my hobbies. Try to get it into a business. What else? I do a few. I think I did one day in the life or two vlogs. I did a few other videos, just some shorts and some juicing. I did a lot of juicing because after I had the vid, you know, the I did I build back my immune system with doing a lot of juicing, and I'm trying to incorporate that into this lifestyle now. So that's why I had my beet and celery and all of that juice today, which I didn't get to drink a lot of. I drank like a sip, but yeah, so make sure I'm asking you please if you could subscribe to my channel. I'm gonna have a giveaway when I reach 100 subscribers. I'm only at 40. Hopefully by the time I put up this video I'm at more. So I'm gonna do a giveaway at 100 subscribers. I don't know what the giveaway is gonna be about yet. So yeah, if I'd really like for you to subscribe and turn on your post notifications for more bariatric videos, or whatever video I upload. Like the video, share the video. I think I'm gonna name the video "Bariatric Surgery in Canada" because you know there's not a lot of, as I said, Canadian videos out there. It's more American or whatever. And I'm gonna encourage people who had the surgery in Canada to do videos and post so other people in Canada can understand your experience. I'm gonna sit and do a sit down video and tell you about my experience from beginning to the day of surgery because it's just to tell you what I did, what I went through, how it is at this particular. Not gonna name the place that I did it. It's not no secret, but and even if I name it, it's not where I live, you know. So yeah, so stay tuned for more videos. This is the week 2 of bariatric surgery, week 2 after bariatric surgery. I promise the next time I'm coming on video, I'm gonna be more, you know. The video I did before this, I was lying down somewhere I was lying down somewhere. So, anyways, my face is up in the camera. It's like I don't want to stop talking, but anyways, um, again, thanks for watching, and I'll talk to you next time. Please like, share, comment, and subscribe. Thanks for watching. Bye.